Good afternoon, everyone. Thank you for joining us today for our presentation specifically for payers. I'm Adam Rossi from the Communication and Outreach Unit here at the Workers' Compensation Board, and today I will share the latest updates on several initiatives that are helping to make the board better for payers and for the workers' compensation system overall. Joining me today to assist with your questions are Gina Jones and James Wessel from our Office of Operations and Programs, Dr. James Tachi, the board's medical director, Paula Rauch, Audrey Cunningham, Christopher Failing, and Eileen Moss from the board's medical director's office, Stephanie Zufali, the board's director of regulatory affairs, Tim Purcell, our chief innovation officer, as well as Mike Hunter and Anthony Contento from the board's Office of Innovation. We do ask that you please keep your phone lines muted, as we will be using the chat feature to receive your questions today. You may enter your questions throughout the presentation in the chat box, which should be located on the right side of your screen. However, we will hold off on answering all questions until the end of the presentation. We will answer as many of your questions as we can, but if you have questions that we don't get to today, or if you think of something after the session ends, we will be providing you with resources at the end of the presentation. Also, we will be providing you with a copy of the slide deck and a recorded version of this webinar. Just make sure you're signed up for email notifications so you're aware when that's available. And if you are not signed up for email notifications, we will go over how to do so at the end of the presentation. So let's go ahead and get started. As we move forward in 2023, we recognize that there's been a lot of activity and communications from the board on various initiatives. So we wanted to provide you with updates and give you an opportunity to ask questions. We'll start with a couple of the most recent updates at the board, including several forms that have been updated for gender inclusivity, as well as regulation updates regarding schedule loss of use and disability benefits. We will then look at OnBoard, the board's improved business information system, followed by the New York Medical Treatment Guidelines, or the MTGs, and some reminders regarding the CMS 1500 form. We will also review important information about workers' compensation as it pertains to COVID-19. Finally, we would like to remind you of some things when submitting first report of injury filings, or FROI filings, and we will review the additional resources available to you. We will then leave time at the end of the presentation for your questions. To start, the board has made some changes to several forms to be more inclusive of the diverse public we serve. On 11 forms that ask for gender identification, the board has added an X designation for people who do not wish to identify as male or female. Gendered pronouns on these forms have also been replaced with gender-neutral pronouns. The following forms have been amended. The Alternative Dispute Resolution Program Report of Injury, Form ADR1, the Employee Claim, Form C3, Employer's Report of Injured Employees Change in Status or Return to Work, Form C11, Application for Reopening of a Claim more than 7 years after incident, Form C25, Notice and Proof of Claim for Disability Benefits, Form DB 450, Preliminary or Final Claim for Reimbursement of Benefits Paid under DBL, Form DB 470, Request for Assistance by an Injured Worker, Form RFA 1W, Volunteer Ambulance Workers Claim for Benefits, Form VAW 3, Volunteer Firefighters Claim for Benefits, Form VF3, Volunteers Notification of Executive Officer of Fire and Ambulance Company of Significant Risk of Transmission of HIV per VFBL/VAWBL Section 11C1, Form VFVAW 11C, and the World Trade Center Volunteers Claim for Compensation, Form WTC VOL 3. This will also help the board use preferred gender pronouns when interacting with stakeholders. You can read more about this by visiting wcb.ny.gov selecting board announcements at the bottom of the home page, and reviewing the bulletin dated June 30th, 2022. Please note that you must submit the current version of these forms. Older versions are not being accepted. One of the board's main goals is to make it easy for workers to receive compensation they are entitled to. With this in mind, we have made recent changes to the process of our Scheduled Loss of Use benefit. A Scheduled Loss of Use, or SLU, is a cash benefit that pays injured workers for the loss of wage earning capacity resulting from a permanent functional impairment of a body part as a result of an on-the-job injury. The SLU amount is determined by the board with proper consideration of the workers' compensation law and the current permanent impairment guidelines, which can be found under the treatment section on the provider page of the board's website. The following changes were implemented on September 30th, 2022. The EC 81.7 has been revised to clarify and streamline the SLU process and expedite a resolution when the injured worker has permanent impairment resulting in an SLU of one or more established body parts. The EC 81.7 now outlines the different paths a case can take for permanency resolution. Any action, for example, obtaining the opinion of permanency, acceptance of an SLU, request to cross-examine a physician, etc., by the parties of interest, or request for an extension must be received within 75 days of the injured worker's attorney's and payer's receipt of the EC 81.7. In keeping with the goal to make it easy for workers to receive compensation they are entitled to, the Chair proposed amendments to Sections 355.4, 363.1, 363.11, 363.13, and additions to Sections 363.15 and 363.16 of Title 12 in the New York Codes, Rules, and Regulations to update and clarify the disability benefits regulations and disability benefits claims process, conform the regulations up to the statute, and align several sections with paid family leave. The notice of proposed rulemaking was published in the October 12, 2022 edition of the State Register. By now, payers should be familiar with our new and improved business information system, OnBoard. OnBoard Limited Release, the first phase of the system, was implemented in phases from March 7, 2022 through May 2, 2022, beginning with the submission of prior authorization requests, or PARs, for medication, known in the system as medication PARs. Today, providers and payers are using OnBoard to request and review prior authorization for medication, durable medical equipment, and treatment or testing. And we have hundreds of these PARs successfully flowing through the system each day. To date, more than 44,500 payers and reviewers have signed up for access, and more than 550,000 PARs have been processed. We are truly working to take the comp out of complicated. As a reminder, payers will need to log into the medical portal to access OnBoard. Every user will need their own login credentials. A single login cannot be provided to an organization to be used by all users who are part of that organization. There is no limit to the number of users an organization can have. Claim administrator access, so the insurer, the self-insured entity, or a third-party administrator, is granted using organizational profiles based on eClaims trading partner information. The payer is ultimately responsible for the review of PARs. A payer may designate a medical review organization to review the PARs. However, the medical review organization must first complete the online medical review organization medical portal registration. Pharmacy benefit managers, or PBMs, may be designated by the payer to review Level 1 medication PARs. The PBM must complete the online PBM medical portal registration process prior to a payer designating them as the reviewer. This chart on your screen labels what submissions each provider type can make in OnBoard. For example, all provider types listed can submit a request for decision on unpaid medical bills, known as Form HP 1.0, non-MTGs under or equal to $1,000 PARs, and non-MTGs over $1,000 PARs. You can view this chart on the Payer Overview page at wcb.ny.gov/onboard. Once a PAR is submitted, you as the payer have a set number of days to respond. Response requirements vary for certain PAR types. Responses for MTG confirmation are required within 8 business days. MTG variant and MTG special services responses are required within 15 calendar days, but the response time is extended to 30 days if an IME is requested. Non-MTG over $1,000 responses are required within 30 calendar days. Non-MTG under or equal to $1,000 responses are required within 8 business days. And medication and durable medical equipment responses are due within 4 calendar days. You can also view this chart on the Payer Overview page at wcb.ny.gov/onboard. Another area of improvement for the board has been the recently updated New York Medical Treatment Guidelines, or MTGs. For those of you who are new to these webinars or to the comp system, we will give you some background. In December of 2010, the board implemented legislatively mandated medical treatment guidelines, known as MTGs, that fundamentally changed the delivery of healthcare to injured workers. The MTGs initially included 4 evidence-based guidelines for the treatment of injuries involving the neck, back, shoulder, and knee. These became the mandatory standard of care for dates of service on or after December 1st of 2010. On March 1st of 2013, the carpal tunnel syndrome MTG and updated versions of the then non-existing MTGs, including a new maintenance care program, were adopted. The non-acute pain MTG, as well as updated versions of the existing MTGs, were implemented for dates of treatment on or after December 15th of 2014. The following MTGs are effective for treatment as of May 2nd of 2022. Knee injury, mid and low back injury, neck injury, non-acute pain, shoulder injury, ankle and foot disorders, elbow injury, and wrist and forearm injuries, including carpal tunnel syndrome, hip and groin disorders, occupational interstitial lung disease, occupational or work-related asthma, post-traumatic stress disorder and acute stress disorder, work-related depression and depressive disorders, eye disorders, traumatic brain injury, and complex regional pain syndrome. The board has online training available on the MTGs for both medical and non-medical professionals. As payers, you should complete the non-CME versions of each training. To access these trainings, you can visit the board's website at wcb.ny.gov. Navigate to the Healthcare Provider section in the middle of the homepage. From there, you can select the Medical Treatment Guidelines link and then select the training link on the right side of the page. Another exciting initiative to help streamline processes and reduce paperwork in the workers' compensation system is the board's adoption of the CMS 1500 form. To reduce the administrative burden on board-authorized healthcare providers, the board made the strategic decision to consolidate and eliminate certain medical billing forms and transition to using the CMS 1500 form, the universal claim form used by medical providers to bill the Centers for Medicare and Medicaid Services, or CMS, as well as health insurers. As of July 1st of 2022, providers must submit the CMS 1500 form. Electronic submission through an XML submission partner is strongly encouraged. As part of the initiative, use of prior medical billing reports, including the doctor's initial report, Form C4, and doctor's progress report, Form C4.2, have been discontinued. Payers are required to use the new Notice of Treatment Issue Disputed Bill, Form C8.1B, and notice to healthcare provider and injured worker of a carrier's refusal to pay all or a portion of a medical bill due to valuation objections, Form C8.4, with applicable claims adjustment reason codes known as CARCs, to object to medical bills. Workers' compensation payers will electronically transmit EOBs and EORs to their XML submission partners upon adjudication of the associated electronic CMS 1500 medical bills. Payers are also required to use specific CARCs on their provider EOBs or EORs when objecting to payment of a medical bill, whether the bills are received through an XML submission partner or on paper. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and causal relationship of the injury at the top of the CMS 1500 form medical narrative. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies provider submissions of the CMS 1500 form. Providers should use this report when submitting the CMS 1500 form. The board strongly encourages providers to include the three elements, which are causal relationship, work status, and temporary impairment, in every clinic note, because that information is so frequently essential to the seamless administration of claims. There are several instances, however, in which this information is not as critical to the payer or to the board, and it is not needed to properly adjudicate the medical bill. One example is a claim in which the injured worker has reached maximum medical improvement, known as MMI, and a permanent partial disability, PPD, classification has been made. Moreover, certain provider types are not permitted to give formal opinions on causal relationship or degree of impairment. For full details on this, please see the WCB authorized providers who can do what chart on the board's website at wcb.ny.gov. In a communication dated November 18th, 2022, payers were notified that they should not routinely file Form C8.1B to deny payment to healthcare providers solely based on the absence of one or more of these three elements. Such legal objections may be resolved in favor of healthcare providers if this is the sole basis for the dispute and the information is deemed by the board to be present, clearly implied, or not critical to the administration of the claim at the time of the clinic visit. If a payer objects to a bill, the legal objection that was filed must be resolved first. If the bill is still not paid after it has been resolved in their favor, providers can file Form HP 1.0. Please note, the CMS 1500 initiative does not change anything related to a payer's assessment of causal relationship. It merely informs providers that causal relationship to be reported prominently in the medical narrative. A PDF of the report, as well as a chart listing medical narrative report requirements by provider type, can be found at wcb.ny.gov/CMS-1500/requirements under the medical narrative requirements section. We urge you to share this template with providers if you notice it is not being used. More information on the CMS 1500 initiative can be found at wcb.ny.gov/CMS-1500, or you can email cms1500@wcb.ny.gov with any questions. Effective July 1st, 2022, payers are required to use the updated Form C8.1B and Form C8.4 to notify the board of legal and valuation objections. Also, payers must use the same CARC and RAR codes on the EOB or EORs sent to providers. Updated versions of Form C8.1B and C8.1B and C8.4 can be found on the Forms section of the board's website at wcb.ny.gov. A crosswalk of the current objection reasons on Form C8.1B or Form C8.4 to the new CARCs, as well as the scenario when the code would be used in any applicable law or regulation, may be found on the board's website at wcb.ny.gov. Search for CARC codes. There are about 40 unique CARC and RAR combinations to address the vast majority of possible objections. If selecting other legal objection on the Form C8.1B, the payer needs to include the applicable CARC code for the objection reason. There are 4 scenarios when you should not be filing Form C8.1B or Form C8.4. When the amount billed for a CPT code exceeds the amount designated by the applicable medical fee schedule, and the payer pays the bill at the medical fee schedule amount. When the payer reduces the amount of the bill to 12, 15, or 18 relative value units for evaluation services and modalities, as set forth in the applicable medical fee schedule. Also, the payer reduces the amount of the bill pursuant to a contractual agreement with the provider, for example, a network or a PPO discount, or when there is a duplicate bill. The reason for payment reduction, or non-payment if it's a duplicate bill, should be set forth on the EOB. As you may already be aware, workers who believe they contracted COVID-19 in the workplace may be eligible for workers' compensation benefits. As payers in the workers' compensation system, you provide crucial benefits to both employees and employers. The employee receives the lost time and medical benefits stemming from a compensable claim, and the employer has the peace of mind knowing its insurance coverage will ensure that employees are covered. We strongly encourage you to be proactive in distributing information about how to file a COVID-19 claim. Employees should be encouraged to file a claim if they feel they contracted COVID-19 at work. You should also encourage employers to help employees file claims and remind them it is illegal to take any disciplinary or discriminatory action against any employee who files or wishes to file a claim. Please review all claims carefully and timely, even if a medical report has not been received. More information on COVID-19 and workers' compensation can be found on our special COVID-19 section of the website, which is wcb.ny.gov/COVID-19. Lastly, the board would like to remind claim administrators to ensure timely filings of first report of injuries, known as ROIs, and to properly notify the board of the correct claim administrator. This will avoid untimely filing penalties assessed by the board's monitoring unit. This also helps provide accurate information to OnBoard, ensuring PARs are given to the correct claims administrator. As we continue to work on implementing improvements for payers, we're committed to increase communication with payers such as this webinar and targeted email. The board also has a special webpage for payers. Visit the board's website at wcb.ny.gov and select the Payers link at the top of the page. We will be expanding content on this page on the What Payers Need to Know briefing page that highlights key activities, much like we've done today. We also plan to continue engagement with all of our stakeholders, including payers, as the board continues its modernization efforts via the future expansion of the OnBoard system. For more information on OnBoard, please visit wcb.ny.gov/onboard. Resources include a walkthrough of the registration process, video tutorials, and recorded presentations for payers. For more information on the CMS 1500 form, please visit wcb.ny.gov/CMS-1500. We do also have a dedicated mailbox to answer all questions on the CMS 1500 initiative, as I mentioned before. That email again is cms1500@wcb.ny.gov. If you have payer-specific questions, you can call our helpline at 877-632-4996. You can also visit our website at wcb.ny.gov and select the payers link at the top of the homepage. For claim inquiries, please visit wcb.ny.gov/contact-claims and submit your questions to claims operations. You can stay informed by subscribing to Get Board notifications straight to your inbox by visiting wcb.ny.gov, scrolling to the bottom of the homepage and select Get WCB Notifications. You get to choose the topics you'd like to subscribe to, by the way, so we will not be inundating you with emails that you're not interested in. You can also follow the board on Twitter, Facebook, Instagram, and YouTube for board news, project updates, trainings, and more. Thank you for attending this presentation on important updates for payers. We will now use the rest of our time to answer any questions you may have. Again, please just enter any questions you have into the chat box. We have our subject matter experts on hand to answer them. We do have some questions that have already come in, so we will be taking a brief period of silence to review those. I do want to mention again, some of you may have signed on late, and I just want to reiterate, we are going to be giving you a copy of this presentation as well as a recorded version. Please make sure you're signed up for email notifications so you're aware when those are available. Again, just go to our website, scroll to the bottom of the page and select Get WCB Notifications, and you can choose the topics you'd like to subscribe to. I mentioned our YouTube page. That's where our recorded version of this presentation is going to be, and we do have past payer presentations on there already. So if you go to youtube.com and /New York State Workers' Compensation Board, you can find those. We strongly encourage you to check those out. And I'm going to put the helpline and the website for the claims inquiries back on the screen too, so you have that. And again, we have a number of questions that have already come in, so I'm going to sign off for a second, let our subject matter experts take a look at what the questions that have come in, and we will be back with you shortly. Thank you.
This is Dr. Tachi, and I'm going to go ahead and take the first question that came in, which was basically it says there are some level 3 PARs dating back to October of 2022. Claimants are calling looking for status on their treatment. How should we answer these questions? So, yeah, I would like to start out by just being very candid with the group. OBLR has been wildly successful. It has done what it was set out to do, which was to make the process more efficient, move a lot of medical questions out of adjudication and into the hands of healthcare providers, whether it's the treating provider or the L2 physician reviewer or the medical director's office. That said, it was so successful that we've all fallen victims of that success to some degree. And so as people know, we've been receiving a large volume of prior authorization requests. The overwhelming percentage of them are handled as the system is designed to at the L1 and L2 levels. But that said, a very large number are coming through to L3. So we at the board have taken action. We've been hiring more staff in what is a very competitive labor market, as folks know. And we've also instituted administrative efficiencies as well. So I think that what you will see is that, so first of all, with things like medication PARs and behavioral health PARs, psychiatric, psychology, et cetera, those typically have a 1 or 2 day turnaround, which we're pretty proud of, because those are very often the clinically most time sensitive. Secondly, we're at a state right now where we are processing many more level 3 requests than we're receiving. So I think that for folks who are tracking this, you've probably have seen in recent weeks or past month or two, not only a higher volume of resolutions coming out, but shorter lag times in those resolutions. And we anticipate that this is going to continue over the next several weeks. So what you can tell your claimants now that are calling with questions, tell them that there is an admitted backlog. That backlog is being reduced significantly, literally every day and every week. And I'm pretty confident that by the next time we convene as a group to meet, I'm not sure when that's going to be scheduled, but by the next time we convene, this will either be a non-issue or a significantly decreased issue, where to the point where it's not even really that noticeable.
Dr. Tachi, I can answer the question on conversion from the C4 family of forms, C4, C4.2, to the CMS 1500. Specifically, there was a question whether payers are allowed to deny the bill for the provider to submit the form on the CMS 1500. Payers should not automatically be denying the bill. There are scenarios where we would not want you to automatically deny every single bill. The good news is that 95% of the medical bills that are coming in have already switched over from one of the C4 forms to the CMS 1500. So there should be a fairly low volume. The other thing I want to mention also is that if providers do not use the correct form, the prescribed form, which is the CMS 1500 plus a narrative, then they are not eligible for the disputed medical bill process, the HP1. So that is really intended to try to get providers to move over to the correct form, which is the CMS 1500.
Hi, this is James Fussell with Claims Operations. There's a question about the email address, claims@wcb.my.gov, and that email address was retired. It was replaced with an inquiry form that's listed up here as a means to contact claims with some simple status requests or updates and things like that. We are looking at, are there additional mechanisms or questions that maybe should be added to that form? But as of right now, there are no plans to bring back the email address. It created a lot of issues around how we properly authenticate parties and what should be coming to that email address versus going to the case folder. So again, if you have an inquiry, you can always use the contact form, or you can send correspondence, which can be an email, to the case folder and have it addressed that way. Thank you.
Hi, this is Paula in the Medical Director's Office. We have a question asking what is the appropriate procedure for adjusters when a PAR is submitted for medication or treatment that is not related to the compensable condition or body part. It should be reviewed for medical necessity, and if you determine that it is medically necessary, but you feel that it is not part of, it's not compensable, you can grant without prejudice at a level 2, but it does need to be reviewed for medical necessity. And asking what factors are taken into consideration when the portal determines what PAR type request falls under. When the provider is submitting the request, they are asked for a series of fields they have to fill in, MTG reference code, CPT code, body part, things of that nature. They're asked to determine if it's a second or subsequent surgery. All of those things lead to the PAR type, the way that the system directs it. There is one question in particular that distinguishes between a confirmation and an MTG variance. It's a drop-down that has three selections. One of them says it's not addressed, one of them says it's consistent, and one of them says it's in the guidelines but not consistent. So sometimes the office staff or the provider who is creating the PAR may not necessarily answer the questions appropriately, and so the system routes it based on the answers that are received.
Hi, this is Audrey from the Medical Director's Office. There's a question regarding whether DME PARs over $1,000 must be submitted. And that really depends on whether it's indicated as such on our fee schedule. The DME fee schedule is noted, and I can include a link on the chat here. The DME fee schedule is on our website and has a column designating which item needs a prior authorization request and which ones do not.
Hi, this is Dr. Tachi again. There's a question that states a physician refuses to use the portal for prescriptions and says the claimant will just have to pay out of pocket if we, the carrier, will not approve the prescription outside of the portal. What recourse does the claimant have when his physician is not cooperating? So, there are a few options there. First of all of our providers are expected to use OnBoard for their PARs and for their medication requests, et cetera. So if somebody isn't or can't, that issue should be referred to the medical director's office. And initially, if it's a skill issue where either the provider or his support staff don't have the ability, they just don't understand how to use the portal and how to use the system, our staff have been very good at walking people through that and getting them set up to use it. If it's a frank refusal on the provider's part to use the system, then it gets directed to our provider compliance committee as opposed to assistance, and it's explained to the provider that they have to if they're going to continue to be an authorized provider. In terms of what the claimant should do, if it truly reaches that sort of that level of an impasse, they might want to consider finding a different provider. I would say that way more often than not, the result is just with assistance from our staff, the provider and their offices are able to use the system.
Hi, this is Paula again. When an MTG confirmation PAR is resubmitted as an MTG variance PAR after being denied at level 2 review, does the PAR bounce back to the level 1 reviewer or the level 2 reviewer? It doesn't really bounce back. It's going to be assigned to whoever is next, but it would go to level 1. Because the confirmation PAR has been resubmitted as a new PAR type, it has to go through that PAR type's process. So it would be routed to the carrier. The level 1 reviewer would have to look at the variance, look at it as a variance, and then it'll be escalated to level 2 if not approved.
There is a question about the proper claim administrator and whether we're referring to the insurer or the actual claim adjuster. We are referring to the insurer and or third-party administrator. For those who are TPAs on the call today, as you're aware, when you acquire a claim, you are required to file the FROI AQ or AU. Receipt of those timely is very important with OnBoard. Otherwise, OnBoard will route that request to the old third-party administrator and potentially delay that injured worker's PAR from being approved. There's also a question about if you can allow the reassignment of in-flight PARs. OnBoard does have that functionality currently. That is limited to the workload administrator role. Any workload administrator for your organization for that specific PAR type would be able to move that request If, for example, someone was out on vacation, left the organization, you would be able to reassign all of those in-flight PARs today.
Question about whether an MTG variance due in 15 days or up to 30 days with an IME. What if the IME comes in after 30 days? Does the provider have to resubmit? So when a variance is submitted, the carrier is required to identify within the system within 5 days that they're going to have an IME. If they do that within 5 days, the system automatically updates the due date to 30 days. The carrier is responsible to respond within that 30 days, regardless of whether the IME came back or not. If you do not respond timely, the system may issue an automatic order of the chair for no response.
About mandatory use of XML to submit medical bills by providers. As of December, we had about 20% of the medical bills that were coming in electronically through an XML submission partner. Payers may actually be seeing up to 50% coming through electronically, especially if they use CARISC as one of their clearinghouses. We are working with the clearinghouses to see what they can do to help encourage electronic submission, especially, again, for those that are using CARISC. We expect it to increase, and it already has started to increase in January. And as you know, and we know that if the bills are coming in electronically, they tend to be more accurate and more complete. So right now we're working on voluntary submission, and we're hopeful that that will increase the percentage of medical bills submitted electronically to benefit the whole system.
There's a question asking, how long do I have to wait to change a denied PAR to granted? Sometimes the action box does not provide that option in the Flight tab. If you have denied the PAR as the carrier, if you've denied the PAR for medical rationale, you should be able to go in at any time and update it to granted after initial denial. If you're not having that ability, I would recommend that you reach out to us with some screenshots to let us know so we can take a look at it. And you can use an email address for the MDO. I can put that into our chat box.
There's a question, will the option for grant without prejudice be available for L1 reviewers? So what I can, this is Dr. Tachi again, what I can say is the board has heard people's opinions, particularly payers' opinions on this very loudly and clearly. I'm not able to promise you at this time that change, that a switch can be flipped and that change is going to take place, or when it would take place. But I would just reassure people that that the board is listening to everyone's feedback very closely, and this is clearly an important issue to folks, and it's something that we are looking into.
Another question on CMS 1500, specifically related to the medical narrative template. Specifically, it's being generated in the notes, and do providers still need to send the CMS 1500 with the billing? So for the CMS 1500 billing, providers need to send the actual bill, 1500, as well as a medical narrative or an attachment. The attachment could be a surgical report. It could be the physician order for a DME bill, those sort of things that are not prone to a narrative. But those two pieces do need to be submitted in order to be complete, because the board also needs that narrative information. It's not just the bill. We need both parts.
There's a question asking, when surgeries meet the guidelines, for example, a meniscal tear or a rotator cuff tear, does it still need a PAR? The answer is no. If it meets the criteria in the guidelines, then a variance PAR would not be required. The provider may choose to submit a confirmation PAR, which is really them just saying, I believe this meets, do you agree this is a correct application of the guidelines? If the surgery is a second or subsequent surgery, then yes, it would need a PAR because it would need to be a special services PAR.
All right, that seems to be all the questions we have today, so we'll go ahead and wrap up. I want to thank you for joining us today. Some really great questions. We always appreciate your participation. I want to thank all our subject matter experts for being on the line to answer the questions today. Again, if we had a question that we either did not answer or we did not know the answer to, feel free to search our website. Again, if you have OnBoard questions, here is our OnBoard website right there. I believe Paula threw in the MDO mailbox in the chat to have questions specifically for them. Feel free to reach out to them. CMS 1500 resources, here you are again, CMS 1500 at wcb.ny.gov, or you can also visit our CMS 1500 page here, and I'll shoot it back to our general payer helpline and website and claim inquiry page. And again, we will be providing you with a copy of this slide deck as well as a recorded version of this presentation. Make sure you are signed up to receive email notifications. To do that, again, please visit our website, wcb.ny.gov. Scroll down to the bottom of the page and select the Get WCB Notifications. We do also distribute information on social media, so please make sure you're following the board on Facebook, Twitter, and Instagram. And again, our YouTube page, it does have dozens upon dozens of previously recorded webinars, which this one will soon be added to it. So if you have any questions, whether it's CMS 1500, OnBoard, payer specific, we have webinars that answer all of it. So I strongly encourage you to visit our YouTube page. And again, just go to YouTube, type in New York State Workers' Compensation Board, and you should be seeing a number of videos that pop up for us. And lastly, please do not forget to visit the payer specific page on our website. Just go to wcb.ny.gov and select payers at the top of the homepage. Again, thank you all for joining us. We hope this was helpful for you. We hope to hear from you again at our next session, which I believe is in, I'm not going to give a date, but if you go on our website, on our webinar page, you'll see a list of dates for payer webinars that are coming up. So we hope to see you at those as well. Again, thanks for joining us. Thanks for your participation. Please enjoy the rest of your afternoon. Thank you.